Yes, so the session was about RIS. Is it really a presymptomatic form of MS or not? So we know RIS very well since a lot of studies have been done by the RIS consortium. We know the natural history of RIS, and until now we believed, and we still believe, RIS to be asymptomatic. Still, there are accumulating evidence of the existence of a prodromal phase in MS. So this is mainly driven from retrospective studies showing an increased utilization of healthcare resources before the diagnosis of MS for various reasons, headaches, depression, and so on. And so the question is, do RIS individuals have prodromes or not? So there is no specific study to address this question, but we have some arguments to discuss, and of course the first argument is to say the reason leading to the first brain MRI, could it be part of MS prodromes? But when we looked at this question, it's really difficult to answer because there are a wide range of different situations. Some situations are really incidental, some situations can be a little bit more complex or challenging, but what we saw is that the reason for the first brain MRI does not influence the risk of conversion to MS and does not have a real impact on the follow-up of the patient. I think that RIS has really well-defined diagnostic criteria. It is challenging, of course, to confirm RIS diagnosis because you have first to have a very good radiological expertise, and you also need to rule out any MS related symptoms, so to be sure there is no clinical episode that could be linked to MS or related disorder. And so this is really well defined. I think what is still challenging in RIS is to know the threshold to define what is a normal neurological examination. So this is one point we discussed also during the presentation, and we also had a poster about this, because of course if you stick to the EDSS score, then all RIS have an EDSS 0. This is part of the definition of the syndrome. But if you go beyond and if you do some cognitive assessment, if you use precision tools to really measure dexterity, coordination with digital tools, for example, or eye movements, then you will unveil some really subtle differences, subtle abnormalities in RIS. And so whether this should be considered as clinical abnormalities still has to be defined. Of course, what is now challenging also in RIS is to decide whether we should treat or not the patients, because we now have 2 clinical trials showing the reduction of the risk of conversion to MS using platform therapies. And we have some well-known risk factors of conversion that can help to decide, but of course I think the management will change in the coming years about the situation. As you said, now RIS is partly included in the new diagnostic criteria.